Welcome to the Breathing Association, a nonprofit organization that works toward one goal, helping our community breathe easier. The Breathing Association is the community's leading resource for promoting lung health and preventing lung disease through education, detection, treatment, and service. We're dedicated to serving low-income and minority populations in Central Ohio, and we've been doing just that for more than 100 years. The Breathing Association was founded in 1906 by Carrie Nelson Black, a pioneer and visionary driven by a passion to care for the sick poor, a passion that took her to Chicago, Boston, and New York in 1898 to study nursing and tuberculosis care. There she met Elizabeth Allen, who became our first home care nurse. Carrie used what she learned to care for Columbus's sick poor, and she was a volunteer in everything she did. She served as the president and chief executive of the Breathing Association for 30 years, as well as a volunteer, and she founded what is now known as Columbus Public Health. The Breathing Association was first located on what is now the parking lot for the Columbus Dispatch, a site commemorated by an Ohio historical marker. At the first meeting, Carrie's intent was clear. The organization would care for the sick poor who suffered from tuberculosis, a lung disease that was the leading killer in the United States at the time. Early treatments for tuberculosis included open-air exposure. The Breathing Association provided coats and medical supplies to patients living in tents, and Carrie used her first budget to buy eggs and milk to help strengthen their health. Nurses visited homes to improve environmental conditions as well, and many of these brave nurses died from exposure to TB. Later, the Breathing Association provided free TB tests to local schools. As tuberculosis became controlled in the 1960s, the Breathing Association shifted its work toward smoking-related diseases like emphysema, lung cancer, and bronchitis. In the 1970s, we began serving asthma patients as well. When Carrie died in 1936, the mayor of Columbus said her work will live on forever. Today, the Breathing Association continues her work by providing exemplary results-oriented services. We partner with healthcare professionals, businesses, donors, and community leaders to educate the community about the devastating impacts of lung diseases. We forecast long-term community lung health needs. We advocate for community-wide approaches to improving lung health. We create and provide population-specific treatment, education, and services. And we maximize the health and quality of life for low-income and minority populations. Our programs and services include the Lung Health Clinic and Mobile Medical Unit, the Home Energy Assistance Program, the Medical Supplies Program, the Senior Lung Health Program, and the Asthma Services Program. We work toward this mission from our planning and volunteer headquarters and our clinic located on Old Henderson Road. We also provide services from our satellite clinics and offices at the Ohio Health Eastside Health Center, Unity Health Center, Gladden Community House, and Lower Lights Christian Health Center.
The Free Lung Health Clinic provides health care for those suffering from lung health illnesses who cannot afford to receive care elsewhere. And like the X-ray cruiser that provided TB tests in the 1950s and 60s, the Mobile Medical Unit provides lung health services to clients throughout Franklin County. Our Medical Supplies Program provides assistance with prescriptions and supplies for those suffering from lung health issues. We've come a long way from our first budget of milk and eggs, but we still work to improve the quality of life of our patients.
Carrie helped fuel the wood stoves of her patients, and we continue that work through the Home Energy Assistance Program that provides utility assistance so that the medically vulnerable keep warm in the winter and cool in the summer. Our HEAT program has become a national medical model. For patients diagnosed with chronic lung health issues, access to heat and air conditioning are critical.
With our HEAP outreach program, we were able to extend our services beyond the walls of our clinics by providing home visits across our community, continuing the work Carrie began.
Carrie worked to care for seniors with tuberculosis. Today, the Breathing Association's Senior Lung Health Program helps care for seniors who face other crippling lung health diseases like COPD.
The goal of the Breathing Association is to help everyone breathe easier, and this is particularly important for those suffering from asthma. Our Asthma Access program provides asthma management services in both homes and clinics to help patients breathe easier.
Our clients are at the heart of our work, and we're here to help them breathe easier.
I have COPD, and when I lost my health insurance, the Breathing Association became life-saving. Every time I visit their office, I feel like I'm really being cared for. The compassion they've showed me is incredible. The Breathing Association was there for me when no one else was.
I came to the Breathing Association through the Home Energy Assistance Program, and because I didn't have any health insurance, they gave me a full checkup. They found that I had glaucoma, which had never been diagnosed. They referred me to the OSU clinic, and this saved my sight.
They have greatly improved our quality of life while going above and beyond to show me kindness and care.
Carrie established volunteerism as the foundation of our organization, and that spirit flourishes today.
I've always wanted to impact the health of my community, so I'm using the talents I was blessed with to help the Breathing Association do that.
I volunteer with the Breathing Association because of how effective it is in providing direct lung health services to those in our community in need.
To be part of an organization that makes breathing easier for others, that's why I volunteer.
It's an opportunity to use the educational and financial gifts I've been blessed with to help those in need.
I volunteer because we provide care in many ways, and that fills a void in Central Ohio that would otherwise go unmet.
Our organization has so much to be proud of through the years, and 2 initiatives stand out as the highlights. The clinic is a national medical model for HEAP and Smoke-Free Columbus. With my co-leaders, Dr. Rob Crane and Bishop Timothy Clark, the Breathing Association, as the lead agency, worked closely with Columbus City Council and city councils of the surrounding suburbs to establish smoke-free air in public and workplaces, leading to a smoke-free Ohio and touching hundreds of thousands of lives. I'm privileged to say that Carrie Nelson Black's vision continues today. That's why we celebrate her work every Mother's Day at our annual fundraiser. It was Carrie, after all, who persuaded the governor of Ohio to issue the state's first Mother's Day proclamation in 1911. From our beginnings one late afternoon in 1906 through today, the Breathing Association serves as Central Ohio's nonprofit leader in caring for those whose lung health is most vulnerable, and we remain committed to a second century of dedicated service.